Hey, it's Jessica DaMassa with WTF Health. I'm here at HIMSS Europe, Health 2.0 Europe, and joining me right now I have Thea Runyan. She is the co-founder of Kurbo, which is this amazing startup that just became a wholly owned subsidiary of WeightWatchers. So congratulations on that.
Thank you.
So I understand you guys, what you do is you're tackling childhood obesity. So give me a little bit of a sense of what you're doing.
Yeah, so we are a scalable mobile online platform for childhood obesity. So current treatments right now are really focused around clinical in-person programs, which are great, but not scalable and not accessible to most kids, the millions of kids and teens in the entire world who need an obesity solution. So we took an evidence-based program from Stanford, where I've been for over 15 years, and brought that to an online digital platform so that we could really scale and reach the millions of kids and teens in the world who are struggling with obesity.
Okay, so what age range are you focusing on here? Because they've got to be old enough to have a smartphone, right?
Yes, and actually almost everybody seems to have a smartphone. So we really, our sweet spot, if you will, is between 10 and 14, but we see kids actually as young as 3, believe it or not. So the foundation of our program is the traffic light food classification system.
What does that mean?
That means that all foods are classified as red, yellow, and green light foods. And so we're trying to making the healthy choice really simple.
Okay.
So we're trying to encourage kids to eat more green light foods, which is fruits and vegetables. You can eat as much as you want. Like, we don't have an issue with that, right? We need to eat more of those. We're trying to moderate our yellow light foods, which make up most of our diet. So that's whole grain, lean protein, dairy, really nutritious of what we need, but we do need to be mindful, right, of portion sizes. And then red light foods, we're trying to reduce those. Those are the kind of the obvious foods that we're trying. Soda, sugary snacks, things like that. We're trying to eat fewer of those. So we work with kids around that framework to really make it simple for them.
Okay, so is it gamified? I mean, like, the color coding is simple, but I mean, that's not necessarily a game, right? I mean, so is when the child is using the app, I mean, is it a game that they're playing? Like, how are they, is it basically to educate them on what fall into those food categories, or what's like the hook there?
So we built into the app a lot of behavior modification. So we are an app plus coaching, actually. So the app really focuses on those behavior modification tools that you need for managing your weight, such as food tracking, setting goals, monitoring your progress. And there's some gaming in there, some gamification. So we're really trying to encourage kids to engage with the app as long as possible. So we know that the longer they track their food and build awareness around their choices, the more successful they're going to be with their goals and with their weight and health goals. And then they actually check in with a health coach once a week over video chat to help them stay accountable, reinforce the educational concepts, so it really makes them accountable. And it's somebody other than their parent. Yeah. And our coaches are super cool. Okay. And we're trying to reduce the stigma around it and really kind of make being healthy fun and engaging, which is new and innovative, right?
So, I mean, I was going to ask about the parental involvement in all of this. So what kind of feedback, are you getting with the parents? And like, how involved are the parents in this stuff? Or is the kid like, Mom, leave me alone?
It depends on the age.
Oh, I'm sure.
As you can imagine, the teens are like, Mom, I got this.
Yeah, right.
But we really encourage parental involvement because we know also that the more the parent is involved, the better the child does, because they're the ones often who are preparing the food, buying it. They're creating that healthy environment or not at home, right? So we want them to be really involved. So when available, we encourage them to be on the coaching calls. Sometimes, again, like with the older teens, they don't want that. Younger kids, you see more parental involvement, but we also have almost a simultaneous parent education component. Because again, the research shows that if parents are involved in this, the more successful the whole family unit's going to be. And parents actually end up losing weight if their kids are doing Kurbo, which is great.
So, I mean, there's a lot of talk about obesity in the industry. I mean, it's the obesity epidemic, and it's one of those things that, I mean, there are a multitude of diseases that come off of this. You've been doing this for a long time. So, I mean, I guess I have a very industry audience that watches. So, I mean, what is one of like the big misconceptions, I guess, about how people are tackling obesity that you've seen, or that, some of the solutions that are out there where it's just like, if there's one thing that we could tweak to kind of like tackle this on a different front, what would it be?
I think digital health. This is where digital health comes in, and this is where we can really leverage the learnings in digital health in general, and telemedicine, and being able to leverage our technology to make it scalable and engage our kids who are using the phones, engage the parents who can't make it to the clinic for their weekly meeting. The current programs are great if you can attend, but they're a huge time commitment. It's usually an hour and a half to 2 hours a week for over 6 months at the clinic. Parents have to drive down there. So they're expensive. So I think that really needs to shift. If we're really, really going to tackle this issue, which of course we need to do because we just see it skyrocketing, right? We need to look at these scalable solutions. And we also need to look at solutions that are specifically targeted toward kids and teens. You know, really when you look at the diabetes landscape, all of the money and the programming is going to adults and going to treatment. Where's the prevention? Right. We need to get our kids started on the right track so they don't end up kind of where we are.
Right. All right, last question for you, and I'm gonna ask this because I do have a lot of startups that also watch, and so I'd love to see a woman-founded startup have a successful exit. So congratulations on that. So tell me, just for some inspiration for those who might be out there watching, like, whoa, I hope I get acquired one day by a company like WeightWatchers. Give me a little bit of a sense of how that happened. How long were you guys in business before? You told me you guys have 3 co-founders. It's you and 2 others, all women and guys. Like, tell me a little bit about your business just before we go.
Yeah, it's a good story. Okay. So as I mentioned, I've been working in childhood obesity for over 15 years, actually at Stanford University, and that's a program we licensed for Kurbo. And my co-founder, Joanna Strober, actually reached out to me because she was struggling with her son. Okay. And she was looking at the Stanford program, but realized all of those barriers that we discussed were an issue for them. She would have to leave work to take her son once a week, and he didn't want to go to a group with other kids. And it's stigmatizing, and he didn't want to do it. And so she called me up, asked for some help specifically for him, and then called me back and said, Thea, I think we have an opportunity here to really to take this and scale it. And for me, my passion really is helping families, and so to be able to take it to that level and to scale it was very intriguing to me. So we kind of roped in our third co-founder, Mark, to help us build it. So he's the tech guru behind Kurbo, and so I developed the program, Joanna helped with business, and he built it.
And so when were you founded?
2013. We launched 2014.
Wow. All right, and you've already been acquired here. And how did that go with WeightWatchers? Did they find you, or did you guys hunt them down?
I think it was very mutual. I know that they had been looking for a kids and teen solution. They're really looking at a whole family. We're very aligned philosophically when it comes to looking at whole child wellness and whole family wellness. And so it's a great synergy when we look at treating the whole family, which is what we want to do, and really addressing the health needs of the entire family. And they're such an amazing, well-established brand, and to be able to work with them just makes a lot of sense to us. So just as kind of a synergistic relationship, I think we both found each other. So it works,
Well, good luck. Thank you so much for joining me and sharing a little bit about what you guys do. Well, best of luck on that. That's a big problem to tackle. So
thank you.
Great for taking it on. I'm Jessica DaMassa with WTF Health. Thanks so much for joining us.